Hello, I'm Kathleen, and as we allow everyone to join, I want to take a minute and share a video with you from our You Can Control Asthma Now program, or UCAN for short, here at Children's Hospital of Richmond at VCU.
All I wanted to do was go outside and play, but I couldn't. See my controller inhaler sitting on the table? I was feeling good, so I stopped using it. Then I caught a cold and it made my asthma flare up. The basketball court would have been way more fun than the emergency room. It was hard to breathe and my mom didn't know what else to do. You see the nurse talking to my mom? She's telling mom about the You Can Control Asthma Now program. UCAN helps kids control their asthma better so that they don't end up in the hospital, like me. My mom made an appointment for me to see the UCAN team, and they taught me how to be healthy and active, even with asthma. That's us. We're learning about asthma triggers, like dogs, cats, mold, and smoke, and medicines that can help me stay healthy. The best part was learning that I could still be active and play basketball, as long as I remember to take my controller meds every day, even when I'm feeling good. I'm back in the game, and I'm feeling great. If I can do it, you can too. You can. Take control, get active, be healthy.
That was great. Thanks for joining us. I'm Dr. Joel Schmidt. I'm one of the asthma specialists here at the Children's Hospital of Richmond at VCU.
Hi, my name is Sasha Gay Overstreet, and I'm the asthma nurse here at the Children's Hospital.
And as I shared, I'm Kathleen Bowden. I am our asthma social worker and program administrator for the UCAN program. So today we're going to be talking about going back to school in person for our kids during COVID-19 and when they have asthma. To do this, we're going to talk a little bit about asthma, about what it is, how it's controlled, about some of the things that can make asthma worse or lead to an asthma attack. Then we're going to talk about going back to school for our kids with asthma. Some of this information is important for any year, but it feels even more significant this year. Then we're going to talk specifically about the science of COVID-19 in regards to children. Then some next steps and answer some questions. So in order to do that, I'm going to turn that over to Dr. Schmidt.
Great. Thanks, Kathleen. So first, the basics. Asthma is airway hyperreactivity caused by swelling. First, hyperreactivity. Everybody has muscles around their airways, not so much the trachea, that has cartilage in it and that stays open regardless. A couple branches later, those airways have muscle around the airway that react to different things. Everybody has airways that react. Some react to everything, some react to little. Think of going outside when it's very cold and taking a deep breath of cold air. Through your mouth, not through your nose. The nose warms the air. When that cold air hits your lungs, you may cough. You may even wheeze. Other things, strong smells, perfumes, cigarette smoke, strong cleaning chemicals, that can cause some reactivity. Some react with a muscle spasm and it just tightens and stays there. And some react with just a twitch. So swelling is what irritates those muscles. If you've ever had a Charlie horse or a neck spasm, a muscle in your neck spasming, you can take a muscle relaxer, it'll make it feel better. But when that muscle relaxer wears out, it's just going to go back into spasm again unless you get rid of whatever is irritating that muscle. In asthma, the hyperreactivity, the muscle spasm, is caused by irritants in the airway that cause swelling. Allergies can cause swelling in the airway, just like it can in your nose. Viruses can cause swelling in the airway. Irritations, like I already mentioned, cold, dry air can also cause swelling in the airway. And the last thing to mention is asthma is a chronic problem. If you're allergic to something, you'll always be allergic to that thing unless you take therapies to help get over those allergies. Some people grow out of their asthma as they get bigger and their airways get bigger, and the same amount of air narrowing doesn't matter. But asthma is a chronic problem and sometimes needs a chronic medication. Sasha, I think I was too confusing.
That's okay to be a little sciencey. What we're going to do is talk a little bit about what's going on and use some pictures. So here's some pictures of some tubes, which are part of the lungs. I like to think of the lungs as an upside down tree in your chest. And those branches of that tree are how you get air in and out. So if you look over here on our pictures, the far left picture is a nice open airway where air can come in and out without any difficulty. Nice soft tissue, relaxed muscles, air in and out. Then we have the second picture. Now here's where asthma or asthma exacerbations come in. There's two things that are going on here. You have the inside, there starts to develop inflammation or swelling is another word to use for it, and mucus, which kind of narrow that airway and make it difficult to breathe. The other big thing that happens is the tightening of those bands. You see the bands around the tubes right there? When they get real tight, they squeeze everything down, and that makes it more difficult to breathe. So you kind of have two things going on here that make it difficult to breathe when you're having an asthma flare.
That made it easier. Well, I didn't have pictures to make it easier. So how do we control it? So you control it with the right medicine used properly. So the right medicine. For asthma relief, it's the albuterol or related substances that relax the airways. But for asthma control, you need a variety of medicines. They come in different pictures, they come in different types. It's an inhaled steroid to get rid of the swelling. If you had redness, itching, and swelling from a mosquito bite on the back of your hand, you can rub some steroid cream on it. The redness, itching, and swelling goes away. Well, you've got redness, itching, and swelling inside your lungs, and the medicine needs to land on those airways. It doesn't work if it lands on your tongue. It doesn't work if it lands in the back of your mouth. It's got to land in the airways. So that's what these spacers are for. If you have a spacer with a mask for the youngers or with a mouthpiece for the older people, that spacer chamber will hold the medicine. You inhale slowly, and that more of that medicine will land in your airways. Just one point here in the picture on the left-hand side, the picture is the purple canister on the top right. That's a dry powder inhaler or a DPI. Dry powder inhalers are not meant to be used with a spacer device. Those medicines are designed to get to the lower airway where they can do their job without using a spacer. Sasha, you teach people about spacers all the time. Did you want to say a few things here?
I would. So we have two types of spacers. There's the face mask spacer, which is that yellow one that's down below. We usually use that mostly with kids up until the age of 6 or 7, to make sure that they can get the medicine, because it takes a little bit of a skill to be able to suck in your medicine and hold it. So we use that one as kind of to start off. And then when they're a little older and can do a little better, we use the mouthpiece spacer. Now, the important thing with these is to make sure you're taking it properly. So I'm just going to give a really quick down and dirty on how to use the face mask. Make sure you always shake your inhaler before you use it. Make sure when you do your puffs that mask stays on the face for a good 30 seconds. And it's a nice tight seal per puff that you use. And with the mouthpiece one, same thing. Make sure you always shake up your medicine before you use it, and make sure that when you puff it in, that you do a nice slow inhale in, but you hold it for a good 10 seconds. And I always say, not a fast 10 seconds, a slow 10 seconds, so that you're counting it out. And it feels like you might pop, but that's okay. We're going to make it to 10. So that's how we do it. Okay, so let's talk about some other things as far as related to what can trigger asthma and some things that you might want to avoid. So the first things are we have allergies, which are big right now, especially because we're moving into spring. The biggest ones, pollen, tree, grass, bush, plant, whatever, it's going to start blooming. And that is a huge trigger for kids with asthma. The other one is exercise. And we're big proponents of encouraging all kids to exercise and go outside and play, but it can be difficult sometimes. When you run a lot, you will notice some wheezing. So that can be another trigger just to be aware of. Other irritants, the big one I always think of is smoking, and that also includes vaping as well. Strong perfumes, mold, dust, things like that, even cat and dog allergies as well. I think I forgot to add that in with allergies, but those are all, triggers for kids. The number one trigger for kids, really, the ones that oftentimes get them in the hospital, are colds, and that's huge. Those are the viruses that really can sometimes really, they'll end up in the ED, unfortunately, or in the hospital from having a virus.
And I'll talk about that, but before we get off this page, I wanted to reinforce this exercise thing. The top says avoiding triggers. We don't want children avoiding exercise. If you find the need to say, no, I do not want a child to go out to exercise because he's going to come back in coughing and wheezing, then his asthma is not controlled properly. We have different strengths we can use. We have different things we can use to control it better. Exercise is a trigger, but avoiding it is not the answer. Okay, so with colds, there are lots of different colds, viruses that can cause an asthma attack. If you think about the last time you had a respiratory cold, it usually starts in the throat with an itchy throat or a warm nose. You get swelling in the nose and runny nose and hard to breathe through your nose. And before, a day or two into it, it moves down to the lung, and it's harder to breathe in the lungs. And for asthmatics, that swelling creates airway reactivity and spasming. And so all those things with any respiratory virus. Now, the virus that causes COVID-19, SARS-CoV-2, is a respiratory virus. And just like any respiratory virus, can cause an asthma attack. So colds are a big cause. Usually in the fall, we see the most colds with people going back to school, kids going back to school. This year, we didn't see that, thankfully, because of social distancing and masks wearing and everything else. We did not see a whole bunch of asthma attacks in the hospital due to colds. So colds are a big trigger. And then lack of adequate control. If your asthma is not controlled very well, and there's a couple ways of figuring that out, and you may be the one to notice it, then any irritation would cause asthma attacks. Proper control does not mean a cold will not prevent an asthma attack, but you're more likely to prevent an emergency room visit, to prevent other medications like steroids by mouth to be used to prevent hospitalization. So you need to be in control. For control, we have kind of a rule of two. If you're using albuterol, if the child is using albuterol more than twice a week during the day when he's not sick, or more than twice a month in the middle of the night when they're not sick, then they probably need to talk about using a controller medicine or going up to a stronger level of control.
Okay, so I'm going to hop in here and talk a little bit about asthma action plans. What you see up here now is our plan that we use with UCAN. It's our asthma action plan that we provide to our patients. It's a guide. But I also want to preface here too that there is the UCAN asthma action plan, but we also have a Virginia State asthma action plan that most school nurses see, that most private and public schools use. The nurses use to give albuterol when our asthma kids come into the clinic. So, and that looks different. That's a 3-tier one. We have kind of a 4-tier. The whole point of the asthma action plan is really as a tool, a guide for parents to help you kind of walk through what's my next step? What do I need to do next? So it's laid out and is when to give albuterol, how much albuterol to give, and when to reach out to us on the UCAN team to maybe we need to do something more, like an oral steroid or something else. And then when to go to the emergency room. So it's a great guide. Have it on your fridge. Just have access to it. Take a picture, put it on your phone. But it's a great resource for parents to have at any time, just to feel prepared.
So I get to be sciencey again. So COVID-19 in children. Children under the age of 18 are less likely to have symptoms from the virus. You can have the virus. We can identify it in a child, but they do not have a fever, no runny nose, no cough, no wheezing, no loss of taste or smell. All the things that the symptoms that associated with COVID-19 will not be present, more likely in children. But they can carry the virus. They can get the virus from anyone and anywhere. They can get it from the teacher. They can get it from the bus driver. They can get it from the clerk at the grocery store. They can get it anywhere from anyone, and they can spread the virus to anyone and anywhere. If they get it from home, they can spread it to others at school. And again, children may not show signs and symptoms of the virus. I think the last statistic I saw was 94% of children have no symptoms. It's like 80% of over 18 have no symptoms. So a lot more children have no symptoms from it. They can spread it to anyone and anywhere. And that's where the caution is. We don't want children to be spreading it around to keep this pandemic going.
All right, so the big key here for just preventative in general, and to feel like have control of your asthma, the most important thing is to make sure that you're taking your everyday controller medications properly and every day. Like those are the big things: consistency and making sure you're taking it the right way and the way that the doctor has prescribed. So if it's 2 puffs twice a day or 2 puffs once a day, whatever is prescribed by the doctor is how you should be taking your controller medicine. And that's going to be really key in kind of protecting your kids against, any types of, viruses they're going to get, because they will get viruses, they will get colds, that will happen. So this is just one of the best ways you can do it. The other thing that I want to just kind of touch on here is just making sure that you're taking in, if you have a dry powder inhaler, that you're not using a spacer, which you can't really use because it's difficult. You can kind of tell when you're, you looking at it, you can't, versus doing an aerosol inhaler, then making sure that you're using a spacer. It's super important. So, and that's about it.
Great. So we've gone through a lot of information with everybody today. You may still have questions, and we've got some questions that came in and we're going to answer. But if you need more help afterwards, contact us. You can contact us at UCAN. When you call this number at 804-628-UCAN, which is 8226, you're going to reach either Sasha or myself, or we will be the ones who will call you back. So if you're worried about your child's asthma, we can talk with you. We can get you in to see one of the physicians. We can help make sure that asthma is not holding your kid back in any way. You can also, if your child is seen at Children's Pavilion here, you can reach out to them through the portal. And that's a great way where you can then send an email directly to your doctor and let them know what's going on, or share any concerns that you have and ask for questions. If you'd like to find more about what the CDC is saying about asthma, we have this link sitting here, and I'm going to let it sit up for a minute because I see it's a really long link. But you can tell about the guidance that the CDC has given to schools and to others about returning to school. And then the last thing is, if you have other questions about asthma and about your children, you can go to our You Can Control Asthma Now, our UCAN program page here at CHOR, that chrichmond.org/UCAN. So I'm going to leave this up for a minute. I have had a couple of questions that have come in. I'm going to let these guys answer. The first is, I guess, Dr. Schmidt or Sasha, that you talked about the importance of asthma control and talked a little bit about control. But how specifically am I supposed to know if my son's asthma is under control or if he is at risk for a big attack?
Okay, so yeah, let me start by saying that it's much better to be a parent or a school nurse for that matter than it is to be a doctor in this case, of knowing what's under control, because you know your child or you know your student better than I'm ever going to know. I see them for 15, 30 minutes once every couple months or something. So if you don't think they're under control, then to give us a call. I mentioned the rule of twos. The use of albuterol more than 2 times during the day per week or 2 times in the middle of the night per month. The other rule of 2 is if they're using more than 2 inhalers per year. That doesn't really count in kids because we frequently will prescribe 2 at a time, so they leave 1 with the school nurse and they have 1 at home. But the rule of 2s is 1. Another one is if your child or if your student can't do the things that they want to do without having an asthma attack, play in the playground without coughing or, exercise intolerance, or, do any of the things that they want to do, then call us. We may be able to gain better control and let them do what they want to do, or let them do what they want to do. And then lastly, so exercise tolerance, coughing, use of albuterol, and lastly is sleeping at night. If they're coughing a lot at nighttime, it may not be wheezing, and you may not think that they need an inhaler, but coughing is another symptom of that airway reactivity. And they may, and if they can't get a good night's sleep, they can't have a good day at school the next day. So any of those things, but more importantly, it's much better to be a parent or a school nurse than it is to be their asthma doctor.
Great, thank you. And then I have a really direct question here, and it says, should my child return to in-person learning at school if they have asthma?
Whatever answer you guys make is the right answer. That is a frequent question. So there are so many different reasons why people should go to school and so many different reasons why they shouldn't go to school. And families can make a more informed choice than I can. So I'm not going to make a blanket statement saying, yes, it's safe for everybody to go back to school. And I'm not going to say, no, nobody should be going back to school. So some of the examples, sadly, there are some children whose their is the free lunch they get at school. I'm not going to say those children can't go to school because the possibility of spreading coronavirus. Those children, have other reasons why they need to go to school. Some children just do not learn well virtually. They cannot focus on the computer. They need to be in a more structured classroom. Those kids know. You may make the decision that I need to send them back to school. Some kids live in a household where there are adults with other risk factors and who have not had their vaccine, and they need to help protect the parents by not bringing a virus home unknowingly. I mentioned the vaccine. That's an important choice to make in your decisions whether children should go back to school or not. Parents who are caring for children, particularly children with asthma or children with more susceptible to the COVID virus, should get themselves protected so they're not spreading it around.
Great.
I think I got all that. Sasha, did you have other things or?
No, I think you hit all the high points. I think the important thing to remember is it is up to I think, like you said, it's up to the parents and oftentimes how they feel about, the situation. If you're uncomfortable and you feel really nervous about it, then maybe keeping them at home is better. But if your child really thrives in an in-school environment and you feel like that would be a better, move to do than to do that. I think it's just, the important thing is to do what you feel comfortable with as a parent and kind of gather the best knowledge you can and make the best decision for your family.
Great. So you talked a little bit about the vaccines. This question actually goes along with that, and it says, my daughter has asthma. Should she be vaccinated for COVID-19?
Sasha, I've been talking too much.
So yes, if they're of a certain age. It's kind of a tricky question. So at this point, we don't have a vaccine for anybody under the age of 16. So only 16 and older can receive the vaccine. Now, I know by talking with Dr. Schmidt that there is some trials in the works for 12 and up, but they're still in the works and we don't have any data now to really know where to go from there. So 16 and up is where we're at, and our suggestion is if you can access it and get it, then absolutely get the vaccine for sure.
And I'm sure people are going to say, well, my child's only 7. You know, what do they have to wait till they're 16, or they have to wait till they're 12? Like Sasha said, there are studies that are fully enrolled now looking into that, and we should know within the year, certainly, maybe by this next winter, whether 12-year-olds are eligible. After that, the FDA will allow us to study age 6 and over. After that, if it's approved, the FDA says you can do age 2 and over. So these trials are in sequence, and the approvals will be gaining approval, hopefully, if they show to be effective and they show to be safe. More to come.
Dr. Schmidt, do we know any dates or timelines for those approvals?
I can't. Like I said, those studies are fully enrolled, and they kind of have to wait for enough children to be exposed to the virus to see if it helps them. So I would imagine it would be at least 3 months from now, and then the FDA, and then they have to crunch that data and submit it to the FDA, and then they have to rule on it. So I'm hoping for the 12 and up to be this fall, maybe by December. And then it would be another 6 months or so for the 6 and up, and another 6 months or so for the 2 and up, and onward.
Great. Thank you so much.
That's just a guess.
Yeah. So those are the questions that we have now, but I'm very aware that we may not have answered everybody's questions. And so please feel free to reach out to us. Again, you can call us at that 628-8226, which is the UCAN number. It's 628-UCAN. It's the easier way to remember it. And again, if we can't pick up the phone to answer either Sasha or myself, we'll get back in touch with you, and we'll look for answers for you. We'll help you schedule appointments if you need those appointments. Again, if your child's asthma is not under control, please reach out to us. We want to make sure that you and your child can do everything that they can do.
Let me make one more point on that, since we got a little time. Is another way of telling control is we can do pulmonary function testing, or spirometry it's called. The older children, usually older than age 4 or 5, can blow into a computer, and we can look at how fast the air moves. It's not something we do now during the pandemic, because forced exhalation can spread aerosols, and if the child does not has the virus and nobody knows it, then they can be spreading the virus here in the clinic. So to do the test now, we would have people come in to get a swab up their nose to test for the coronavirus, and if that's negative, then we can do this pulmonary function testing. But hopefully, as the pandemic gets better, that restriction will be limited and or lifted, and we'll be able to do that testing again too. So if you're not sure, and we're not really sure, we can do some testing to look at what exactly is their level of airflow limitation.
That's a great point, Dr. Schmidt, because one of the advantages of our clinic is that we do have a variety of means of testing and expertise at our disposal that can really help kids and help their families. Great. Well, thank you all for coming.
Bye-bye.
Bye.